My name is Julia Featherstone. I'm 49 and I live in Bradford. I was diagnosed with ovarian cancer in February 2011. My feelings on being diagnosed with cancer were almost indescribable. I felt like it was a death sentence for me. I have personal experience of this cancer in my family, and it was just the worst news I could possibly have. I had a clinic appointment and I met Beverly, my Macmillan nurse, at that appointment.
My role involves looking after women with a gynecological cancer, and that's when it's suspected or known through treatment, through all the investigations, and then beyond into the follow-up phase.
I was very frightened when I went to the clinic, and I met Beverly and my surgeon on the same day, and the first reaction I think I had was that Beverly, Macmillan nurse, that means I'm dying. First reaction, but she set my mind at rest almost immediately and said that she wasn't somebody who would deal with somebody at the end of their lives. She was there to help me with my diagnosis, my treatment, with any questions I might have, and just to use her as a point of contact in case I had anything that I needed during that time. I was so grateful for that.
I work also with the family and friends of the patients. The patient can contact me at any time, but if a patient wants me to go out and see them, I will do. And in one occasion, I did actually go and find a patient because she wouldn't answer the phone. So sat on the drive, rang her and she picked the phone up. And then, of course, she said to me, well, where are you? And I said, well, I'm outside, I'm looking at you. So I was able to get in to see that patient.
I phoned Beverly all the time. She must have got quite sick of hearing from me, to be fair. But I had so many questions. You know, I'd never had any hospital treatment before, apart from really minor things. So, you know, going into a major operation as I was due to, and the chemotherapy, all those things, I just didn't know anything. So I had questions about things as basic as hair loss, what I should be trying to eat, all those things that you don't normally think about. Things like, just awful things like going to the toilet, you know, were an issue at the time.
Macmillan Cancer Support have always supported me in my role from the day that I started this post, which was 10 years ago. They provide a lot of teaching and learning opportunities, but they also provide a lot of one-to-one discussions, and you can use them for mentorship and clinical supervision. I really enjoy fundraising, and I'll do anything to fundraise for Macmillan, whether it's standing in a supermarket foyer with a bucket, a coffee morning, we've done concerts, all those sorts of things, anything that will help provide funds for Macmillan. If you're having a down day, go and do something for Macmillan. With this money though, what do we do with it? Well, we are looking at our services all the time, and it's very obvious to me that when I first started there were a lot of nurses, and now we're able to provide lots of other Macmillan professionals to help people on their cancer journey. My proudest moments of being a Macmillan nurse, I don't think there's anything in particular, because I just like my job. I like doing what I do, but it's more than a job. I enjoy the fundraising as well, but for me it's getting a lady through the treatment, getting her to the right place at the right time, and then we've had the treatment and then she's on her way again and getting on with her life.
She was able to reassure me in so many different ways, and you know, I just don't know how I would have dealt with that period without her.